Good day, classmates. We are the Group 4 and our report is all about the applications of the NEUPI. So first, we will discuss the uses of Form R and Form S. The first group actually discuss this topic, but we will elaborate the differences and commonality of these two forms. Form R is also called Observer Rating Scale, while Form S is also called Self-Report Questionnaire. So when to use Form R or Observer Rating Scale, it is preferably used than self-report when the individual is physically or mentally unstable in completing the test, or there is tendency to highly falsify responses on the test. So if the examiners see that the client is incapable of answering the test alone, Form R will be used. So there will be observer who will observe the client using global rating. And additionally, Form R version of the NEO inventories is composed of detailed questions to form reliable and validated scales and to provide norm for adult and adolescent. Moreover, in research, Form R is mostly used when research is on groups or when researcher utilizes group observation. Lastly, the value of personality ratings depend on how well rater understands the person being rated. When friends, neighbor, family, or classmate are used, it may be wise to average score from 2 or more raters to increase the accuracy of the rating. For Form S, the client alone will answer 240 statements uh, regarding his or her personality. Self-report questionnaire, some reviewers have concluded that self-report measures are superior to observer rating scale in the prediction of independent criteria, and it is most widely used source of personality data. Form S is said to be more accurate than Form R because individual has widest and most extensive opportunity to observe his or her own behavior and is privy to thoughts, feelings, and desires that are not publicly expressed. That is why it is said that Form S is more accurate, preferably than Form R. So now, what is common between Form R and Form S? So both forms are highly acknowledged and used in personality assessment. And in addition, one person's self-report and another's rating of him or her may show considerable divergence on one or more traits. Thus, the professional should not assume that observer rating scale are interchangeable with self-report, or they give fully accounts on how individuals see themselves. So the main difference of Form R and Form S is that Form R uses observer to rate the client, while Form S, the client himself or herself answers the statement on the test. It is also said that both client's perspective and significant perspective of others may be valuable to yield insights into the basis of interpersonal difficulty, which means that Form R and Form S can be both administered to client.
Okay, let's continue about the self-report and observer ratings. So self-report and observer ratings is often valuable in research. Why? Because not all data gathered are accurate. Example, their honesty, interpretation of questions and the likes. But for clinicians and counselors, self-report and observer ratings have important functions in helping them understand an individual client. Next is the use in research group. Ratings on Form R may often be successfully substituted for self-report on the NEOPI 3, or Form R can be used as an alternative measure or as a supplement to self-report. So, as a result, when the criterion to be predicted is a self-report measure, the use of Form R considerably strengthens the research design by allowing the investigator to rule out shared method variance as an explanation for findings. And lastly, it helps clinicians and counselors to understand an individual client. Um, by spotlighting particular problems individuals may be facing depending on their test outcomes, and for providing informations about clients' problems, setting goals, and planning interventions.
Next, we have here also the application of NEO-PI3. It can be applicable in clinical setting, uh, counseling, and psychiatry. Yung result ng NEO-PI3 can give the counselor a rapid understanding of the client and during disposition, and thus can facilitate the counseling process. It offers also information that may be valuable to the counselor or clinician in many other ways. That's why sharing the test result with client may be an appropriate way to develop self-understanding. Under the application of clinical setting, we have here six. Number one is understanding the client. The first and most basic contribution of the NEO-PI3 is to aid in understanding the client. Of course, no clinician would think of beginning therapy without first knowing the client's sex, uh, age, and something about his or her social, educational, and occupational history. In the same way, understanding basic emotional and interpersonal, experiential, and motivational style would seem to be prerequisite to an effective therapy. And the NEOPI3 profile can give a systematic assessment early in the process. Second one is the diagnosis. The NEOPI3 was not designed to diagnose psychopathology or mental illness, but according to DSM-5, personality traits are relevant to the diagnosis of many disorders, and then the NEOPI can provide objective measure of this trait. The clinician can use the NEOPI3 in two ways. First, score can be used to suggest possible diagnoses that can be further assessed by other specialized instruments or by interview. For example, lumabas yung score niya is high and for self-consciousness, and it might suggest diagnosis of social phobia or low conscientiousness, and it might be an indication of adult attention deficit hyperactive disorder or ADHD. Adult attention deficit hyperactivity disorder. Second, on a less formal level, knowledge of personality trait can help the clinician to understand and put in context the presenting problem of the client. For example, anxiety and depression may be a chronic part of life for the high-end scorer, but may indicate specific situational stress or for the low-end scorer.
Let's move to number 3, the empathy and rapport. So according to studies, the NEOPI3 can provide the clinician with insights into many features of the client's personality. Di ba nga kasi this test measures the ocean of a person, or the O, openness, C, conscientiousness, E is extroversion, A is agreeableness, and N is neuroticism. And according according sa nabasa ko na once nalaman ng clinician yung results, he or she will use it in communicating with the client, and a client who perceives that he or she is understood is likely to appreciate the skills of the clinician, and rapport can develop more quickly. So, ibig sabihin, when the clinician is sharing this NEOPI, or kapag nalaman ng clinician yung result ng NEOPI 3 is pwede na ito yung magiging first step niya in order to build a rapport with his or her client. Let's move to number 4, the feedback and insight. So how does the results of NEOPI 3 can develop or help the client in order to uh, have an insight or magkaroon sila na ma-share nila yung feedback nila sa client. So, one of the goal of counseling and psychotherapy is to help individuals understand themselves. So, and for many clients, sharing the results of the NEOPI-3 may be a useful first step in counseling. So kapag nalaman ng clinicians yung results ng NEOPI-3 nung client, nagkakaroon sila ng ideya or insights paano siya makicommunicate sa client niya, and magkakaroon siya ng ideya kung ano ang personality ng client niya. Kasi nga 'di ba, nami-measure niya yung ocean, yung sinabi ko kanina, and napag-aralan na natin matagal-tagal na yung openness, conscientiousness, extraversion, agreeableness, and neuroticism. So, nami-measure niya yung 5 na personality ng isang tao. So, for clinicians, malaking tulong yung results ng NEOPI-3 para magkaroon sila ng insight about their clients. Let's move to number 5, the anticipating the course of therapy. So, paano nga ba nakakatulong ang NEOPI-3 to anticipate the course of therapy? So, according to studies, the NEOPI-3 can provide valuable information on the patient's prognosis and kung ano nga ba yung possible response ng client sa therapy na ibibigay sa kanya. So, for example, individuals low in conscientiousness are often unwilling to undertake the work of psychotherapy, or ayaw nila yung treatment ng psychotherapy, and sometimes sila daw yung mga nalilate sa mga appointments or sessions with their clinicians. They also have low tolerance for frustration. So, nahihirapan silang harapin yung mga problema. So, through the NEOPI-3 or the results of the NEOPI-3 is malaking tulong daw in order to understand their clients, in order to know their, magkaroon sila ng ideya kung ano nga ba yung personality ng isang tao para malaman nila kung this client is magre-respond ba sila positively sa therapy na ibibigay sa kanila. So, ma-anticipate nila kung ano nga ba yung pwedeng therapy na ibibigay nila, or ano nga ba yung intervention na better for their clients. So, let's move to number 6, the paano nga ba nakakatulong ang NEOPI so that the clinician will select the optimal treatment for their clients. So, most counselors and clinicians employ a variety of forms of therapy, and those treatments depends to what is the need of the client. Yung treatment na ibibigay ng clinicians is nakadepende kung ano nga ba yung kailangan ng client. So, for example, yung results ng NEOPI-3 ay lumalabas na, or yung individual is mataas daw sa E or the extraversion, depressed patients responded better to interpersonal therapy than to antidepressant medication. Yung mga matatas daw yung score sa extraversion is mas nagre-respond daw sila better to interpersonal therapy than to mga antidepressant medication. So, with regard to openness, unconventional forms of therapy are often welcomed by high O individuals, or yung mga matataas daw sa openness is mas gusto daw nila yung mga unconventional forms of therapy. However, sa mga mabababa naman ang openness, mas prepare daw nila yung emotional support and mga common sense na advice. This is according to studies. So, the NEOPI-3 results can help clinicians to understand the client, or to have an idea and to better select kung ano ba yung best na treatment, or should I say the proper treatment or intervention dun sa client. Ang pagsiselect naman kasi ng optimal treatment or yung intervention na ibibigay natin sa client is hindi lang dahil kaya natin ibigay or kaya nating or skills natin yon. Hindi lang naman dahil ito yung kailangan ng client, but minsan kailangan nating i-consider na or na-anticipate natin na i-consider yung client yung ganitong intervention or mas prefer nila ito. So, hindi natin dapat pinipilit yung mga treatment sa kanila. The NEOPI-3 results can give the counselor a rapid understanding of the client's enduring dispositions and thus can facilitate the counseling process. So, sharing the test results with the clients may be appropriate way to develop self-understanding. So, yung results daw yung pag-share daw ng results ng NEOPI-3 is according to studies, way ito para daw maintindihan ng client yung sarili nila or magkaroon daw sila ng idea or mas magkaroon sila ng deep understanding sa mga sarili nila. So, but of course, this test or yung mga iba pang mga tests, we should not use this as a sole basis to diagnose individuals. We should employ different instrument or kailangan dumaan sa assessment in order for us to diagnose a client or para masabi natin yung client is merong ganitong sakit or personality disorder. However, responsibility pa din ng counselor or clinicians to judge whether appropriate bang i-share yung results ng NEOPI-3 sa client. To provide an opportunity for discussion of the results and to explain the results in understandable terms. So, ibig sabihin, yung NEOPI-3 is, yung results ng NEOPI-3, i-share natin na in understandable manner or ways. We should not share the results of NEOPI-3 na mas maguguluhan pa yung client kung sa mga sarili nila. But ang goal natin is para maintindihan nila yung mga sarili nila. So, yan yung clinicians or yung kung paano nga ba yung NEOPI-3 is nakakatulong sa mga clinicians or in clinical settings.
Behavioral medicine and health psychology. The NEO inventories have been used extensively behavioral medicine with published research on such topic as coronary-prone behavior, Parkinson's disease, and the health of spouse caregiver. The coronary-prone behavior are actions or patterns of actions believed to be associated with an increase of coronary risk increased risk of coronary heart disease or yung sakit sa puso. Well, the Parkinson's disease, ito yung brain disorder that cause unintended or uncontrollable movements tulad ng panginginig ng katawan, pagmamanhid ng katawan, tapos pagkawalan ng balance or coordination yung katawan. Tapos habang ito ay lumalala, nahihirapang maglakad or magsalita yung tao. Students of behavioral medicines have developed a variety of scales such construct as coronary prone behavior, health locus of control, and abnormal illness behavior. Those scales address narrow and focused issues about health psychology. The coronary prone behavior, ito yung nabanggit ko sa taas. Ito yung mga actions or behaviors that can increase risk coronary heart disease or yung sakit sa puso. Basta coronary, saan makikita yung coronary? Dun sa puso. Tapos, yung health locus of control naman, ito yung belief na that health is in one's control or ito yung internal control na sinasabi nila. Tapos yung external control naman, it is the belief na it is not one's control. It's not your control. For example, yung student na may internal control ay sinisisi niya yung sarili niya kung bakit siya bumagsak. Sinisisi niya, she or he thinks na she did not do her best, her effort is not enough, kaya siya bumagsak. Pag external naman, isisisi niya sa guro yung pagbagsak niya or sa other factors na hindi sa sarili niya. Tapos, yung last is abnormal illness behavior. It is described maladaptive perceptions and experiences of one health status. In correlations with NEO-PI3, scales can provide fixed referred point from which the assessed such scale. Seconds, in interpreting the score of individuals, the additional information provided by the NEO-PI3 can clarify the meaning of other scale scores. Yung isang importance ng research using the NEO inventories has been the study of patients with HIV or AIDS. It shows that personality traits, especially low conscientiousness, were associated with increased health risk behavior in a particular population at risk of HIV infection. So, yung mga may HIV, kadalasan daw ito yung mga may low conscientiousness. Health habits and attitudes are another where personality variables have been shown to be eliminating because yung mga tao na mataas ang N at mababa yung C, ito yung mga taong kadalasang naninigarilyo at ito yung mga taong hindi madaling sumuko. Let's go to the vocational counseling and industrial organizational psychology. Vocational interests are slowly related to personality, particularly extraversion and openness. The NEO inventories are used widely around the world for research and applications in industrial organizational psychology for such purposes as police selection, transformation leadership, and teamwork. Vocational counseling is a set of services designed to develop the skills and ability to practice a vocation in a productive way. Ito yung kaya nabanggit sa police selection because it is under the vocational counseling wherein before ka maging police, magtre-train ka muna, meron yung tinatawag nilang 6 years na training wherein may academic doon tapos militaristic training bago ka maging police. Kasi sa police recruitment, madaming process yan. May mga test, neuro exam, tapos interviews, paper and pencil, and oral examination. Tapos, kaya nabanggit yung training dito para sa definition ng vocational counseling, set of services designed to develop the skill and abilities to practice a vocational in a productive way. Kaya meron silang training tapos academic para malaman nila yung skills and ability nila, yung limit nila. Tapos, yung academic naman para madagdagan yung knowledge nila. Kung naaalala nyo yung sinabi ng speaker natin sa review natin sa IO noon, na train nila at nagpapaseminar sila sa employers nila to develop or enhance their skills and ability and to give them more knowledge about the company or the work. Results from the NEO-PI3 may reinforce or modify interpretations of vocational interest scores. For example, pag yung sales lady ay high sa sales interest pero low sa extraversion, may have been careless in completing the vocational interest or hindi niya naiintindihan yung nature of the work. Kaya siya low sa extraversion. Let's go naman to the Neo job profiler. A tool that may have been used for identifying traits relevant of a particular position. This instrument consists of itong Neo job profiler ay ito yung tool to identify traits relevant sa particular position. This inventory consists of 30 items corresponding to the identified facet of the Neo PI tree, with each traits describe a language understandable to non-psychologists. Tapos ito yung 30 items na ito are assigned a numerical value from -2 to +2, wherein -2 is very undesirable and the +2 is very desirable. Except sa Neo 6N facets, because ito yung 6N facets ay revised. Tapos, the Neo job profiler of a techniques for determining the traits are desirable for a particular job. Itong Neo ay ide-determine niya kung Neo job profiler kung yung traits ba are desirable according to dun sa assigned numeric value na -2 to +2. Kung yung tao ay desirable sa particular na job. It yield yun lang para malaman lang kung yung tao ay desirable para sa isang job.
Next is
Cross-cultural research. Ang ilan sa mga pinakapanabik-nabik na natuklasan tungkol sa personalidad sa nakalipas na dekada ay nagsimula sa mga cross-cultural na research gamit ang neo-inventories. Ang mga instrumentong ito ay angkop para sa naturang pananaliksik for nature. Sa dalawang dahilan, una dahil naisalin na ang mga ito sa 50 different language and dialects, at pangalawa dahil nag-aalok sila ng komprehensibong modelo ng mga katangian ng personalidad. Ang bihasang tagapagsalin or translator na may background sa psychology ay lumikha ng mga epektibong pagsasalin ng Neo-PR, at ang 5-factor na istruktura ng Neo-inventories ay lubos na naipakita sa dose-dosenang sa maraming kultura, mula Iceland hanggang Ethiopia, mula Israel hanggang sa iba't ibang bansa. Ang 5 pagsasalin o ang 5 factor ng neo-inventories ay neuroticism, agreeableness, openness, conscientiousness, and extroversion. Ang pinakamahalagang natuklasan sa cross-cultural research ay ang pagkakaiba ng sex or kasarian sa mga katangian ng personalidad or personality, bagamat katamtaman sa laki ay pangkalahatan. Halimbawa, sa halos lahat ng kultura, mas mataas ang marka ng kababaihan sa pagsang-ayon kaysa sa mga lalaki. Totoo ito sa mga self-reports at sa observer ratings, whether it is female or male ang observer. Ayon sa pananaliksik, ang mga babae at lalaki ay pareho sa pangkalahatang antas ng extroversion. Ang mga babae ay patuloy na mas mataas sa warmth, samantalang ang mga lalaki ay mas mataas sa assertiveness at excitement. Mas mataas ang marka ng mga lalaki sa buong mundo sa openness to ideas, samantalang mas mataas naman ang score ng kababaihan sa openness to aesthetics. Ang mga pag-aaral ng mga pagkakaiba ng kasarian ay maaaring magiging mapaglinlang kung ang 5 salik lamang ang susukatin. Dumako naman tayo sa pag-uugali or behavior and molecular genetics. Dahil ang 5-factor model ay universal at ang Neo-PI3 ay comprehensive, ang Neo-inventories ay naging mga karaniwang kasangkapan sa mga international researches na parehong asal at molecular sa genetics. Ipinakita ng kambal na pag-aaral sa Canada, Germany, and Japan na ang mga katangiang tinasa ng NEOPI3 ay lubos na namamana or hereditary. Ang isang pag-aaral gamit ang data ng Canada at Aleman ay nagpakita na tiyak ang pagkakaiba-iba ng mga marka kung ano ang kanilang sinusukat sa itaas at higit pa sa 5 mga kadahilanan ay nagmamana din. Eksakto kung aling mga gene ang tumutukoy sa mga antas ng katangian ang naging paksa ng matinding pag-aaral sa nakalipas na dekada. Ngunit sa ngayon ay hindi malinaw ang mga resulta. Ang mga gene or genetics na tila promising for the earlier studies ay nabigong magtiklop sa mga susunod na pag-aaral or studies. Naging malinaw sa ngayon sa karamihan ng mga researchers o mananaliksik sa lugar sa mundo na ang bawat katangian ng personality ng tao ay malamang na resulta ng napakalaking bilang marahil ng daan-daang iba't ibang genes sa mundo.
So one of the applications of the neo personality interest is on educational psychology. So the advent of the neo-PI is likely to have the very important consequences for the study of educational psychology because this offers validated, which is the accuracy, age appropriate, or this is the level of a development, which measures a wide array of relevant personality traits. So in neo-PI, there are two domains, the openness and conscientiousness, that promise to be a particular interest in educational psychology. In openness, this is the modesty related to measures of intelligence, or somewhat more strongly related to their divergent thinking. Divergent thinking, this is the ability to generally thought to contribute to creativity. For example, in open students, they are likely to avail themselves or profit from in education, and then openness itself can be increased by education, as the concept of the liberal education has traditionally assumed. In conscientiousness, students are well organized if they have conscientiousness. So they are purposeful and persistent, and there is some evidence also that suggests that trait leads to higher academic achievement. So people consider themselves in conscientiousness when they are rated by others as being intelligent, and scores on this domain scale may be useful supplement to ability that measures as predictors of academic and then later life of success. So in NEO, this will provide a thorough and proven assessment of someone's emotional, interpersonal, experimental, attitudinal, and motivational styles in educational psychology. Like, for example, in clinical, in schools, counseling or in guidance counseling, and then in other educational setting. So this is our report from Group 4.